so it's not mic'd for him. Okay. Good morning. If we could ask you folks to take a seat, we'll get started. Hi, I am Jim McAleer. I'm the president and CEO at Alzheimer's Orange County. Welcome on a very rainy day to what is probably our last in-person public training for the short-term future, right? Because of coronavirus, we've actually taken quite a few steps in our organization, largely because of who we serve. We serve a lot of folks who are over 60, who are frail. And as we know, they're more vulnerable to this particular virus. So you'll see our handshake-free zone, right? That includes hugging and kissing, by the way. Sorry about that. We also have more Purell than you can shake a stick at pretty much everywhere in organizations. And we'll be implementing a work-from-home policy. So is it overkill? You hear a lot of people talk about the hysteria. I would tell you, if it is overkill, why not? The risk is minimal to going too far in prevention, and the reward is great if there is a true and serious risk upon us. So we're going to err on the side of caution every single time. Canceled our gala and pushed it out 4 months. So we're here to help. We have a fair amount of information. You can find it on our tables in the back. You're also welcome to call our helpline. But today is not about anything I have to say. Today is about the medical expert. So Dr. Trinh is a member of our board. He was the medical director at Memorial Care for quite a few years and is now firmly entrenched with Irvine Clinical Research, as well as being the medical director at our North County Day Center. So clearly he has a lot of free time. Not. He's also one of the few people I know who has a great deal of scientific knowledge, who translates that into something I can understand with my limited intellect. So I think you'll enjoy him, and certainly we'll have some Q&A at the end. Dr. Trinh?
All right. Is this on? Cool. Can you guys hear me okay? Yeah? So far? Oh, good. You made it here in the rain. So, I'm curious. How many of you guys have a lot of toilet paper at home? I'm just kidding. Now you know where to get toilet paper, right? When you're running low. Do you want to hear some good news first? Because all you're going to hear is bad news, right? The good news is that in the area where it all started in the city of Wuhan, China, right? The good news is that the new cases are starting to drop and go down. And so, to me, that means that at some point, there's going to be an end to this, right? The new cases are beginning to drop in those areas where there was a huge breakout initially in China. So that's good news. This is going to end. The question is, what can we do now to limit the damage while we know there's going to be an end? Does that make sense? All right. What have you guys heard about this virus? I'm just curious. What's out there in Laguna Woods or the news or things of that sort?
It's not the earliest virus, it's swine flu. Which had 60 million cases in that time.
Okay, he said it's not nearly as bad as other epidemics like swine flu and SARS. So when we look at maybe the percentage of deaths, right? You're absolutely correct. I think SARS, anyone remember SARS? Yes. What year was that? 2003-ish. Does anyone remember the death rate in SARS?
I was in Hong Kong.
You were in Hong Kong.
Yes.
Wow.
I taught in Hong Kong.
You're teaching in Hong Kong, and so you probably escaped SARS to come here, only to face now coronavirus, right? So the death rate with SARS was around 10%, 1 out of 10 patients. That's a lot, huh? The death rate from other Other outbreaks, Ebola was like 40, 50%. Very scary, right? There are other viruses that had a more significant, more scary death rate. What is the death rate of this new, we call it the novel coronavirus, or the other word we call it is what? Anyone know? COVID-19. Anyone know what why we call it COVID-19? Coronavirus 2019, right? It was just a label to label that. What is the death rate of coronavirus? I heard 1%, I heard 2%. It sounds like a bidding war, right? I heard 3%. Depends on age group.
Healthy, it's very low. You may not even know you have it. Elderly with underlying health symptoms, different story.
Yeah, so it depends on age group. So the number out there, we've been given all kinds of numbers. The official World Health Organization number, I think it was out a few days ago, right? It was around 3.4%. What that means, according to the World Health Organization, is that if you have 100 patients infected, on average, 3.4 patients will pass away. But that is an average number that they've calculated because the numbers are actually all over the place depending on the country you live in and the city you live in. Does that make sense? And the numbers is also skewed because the way we calculate the death rate is we look at the number of folks who have died compared to the number of folks who have been confirmed as having this virus, right? There's a numerator and a denominator. Does that make sense? And so the accuracy of your number really depends on how accurate, your denominator is. Are you really testing everyone who's out there? Or are you only testing a few who are actually sick, and so that limits and skews your number? Does that make sense? Yes. That's why in areas like maybe Italy, the death rate I hear was like 5-6%, right? And this changes every year. I mean, every day, actually, not every year. Things are changing. What I'm telling you today, March 12th, may change in 2 days, in 4 days, and by next week because the numbers change as we're gathering data on this. Does that make sense? What's the number for the U.S.? Right? Right? It really depends. The number in the U.S. is going to be a number that's not accurate, and I'll tell you why. Because we are limited in the number of folks we have been able to test so far, and we are only testing the sickest of the sick. When you're testing the sickest of the sick, right, those numbers will be higher, right? The confirmed numbers will be higher, but it's very limited because it's a very small denominator compared to maybe a country like South Korea. Does anyone know how many people are being tested a day in South Korea? 10,000. At least 10,000, right? At least 10,000 folks are being tested a day. So South Korea's probably got like the largest database that we have so far. And the death rate in South Korea is under 1%. I believe it's either 0.5, 0.6, something like that, right? Within that range. So that gives me some relief, right? Because they are testing a lot of folks. And so that number changes again depending on how many people you're able to test. Here, if you're walking around here and you have symptoms of the cold, right? A little sniffy nose, cough. What are the chances somebody's going to test you for it? Right? So if you are walking around with mild symptoms of this coronavirus, chances are you probably won't get tested because of the limitations we have today in the number of testing kits. So the numbers would not be accurate. The only way you'll know for sure the actual death rate is if everybody was tested and you knew for sure how many people were out there who had this compared to the number of people who have died. Does that make sense? So how is this coronavirus similar to the flu, and how is it different? Right? How is it similar to the flu, and how is it different, and what can we do about it? Does anyone know the similarities between coronavirus and influenza?
Yeah. It's the same symptom, almost same symptom. We can confuse with it.
Similar symptoms: fever, cough, shortness of breath, right? Very similar symptoms as the flu. So it's not easy to to distinguish sometimes, and it makes it harder because when we're in this flu, season as well, it does make it harder to distinguish. So those similar overlapping symptoms, we know that based on the current data we have, 80% of coronavirus infections are considered mild. They're mild to moderate, 80%. That's good news, isn't it? 8 out of 10 folks who catch this theoretically can be treated at home the same way that you would treat the flu at home. Does that make sense? Fluids, rest, Tylenol, right? Supportive care. Whatever you do to treat the flu at home, 80% of patients with coronavirus is treated with supportive care at home. That's good. The symptoms are similar. The initial symptoms are very similar with fever, cough, respiratory symptoms is what we see. Does that make sense? How's it different than the flu? I heard it's much more contagious. We don't have immunity.
We have a long carrier aspect to it, like 12 to 14 days, and we don't even know we have it.
And a longer incubation period. Those are all correct. This coronavirus isn't a virus that the human body recognizes. The human body have recognized the flu for thousands of years because it comes every year, right? So our immune system, it sees the flu, it recognizes it, it attacks it. And because of that, what is the death rate from the flu? Does anyone know?
20,000 this year so far.
Right? So the total number of deaths from the flu this year is very high. Did you know that this year, this flu season, there's been over so in the United States, we have, 300-something million Americans, right? This flu season, around 1 out of 10 of us have caught the flu, around 30-something million Americans, right? 10% of us have caught the flu. Of that 10% that caught the flu, how many were hospitalized? Does anyone know? And how many have died? Does anyone know? For this flu season alone. So the hospitalization rate for this flu season is over 300,000, right? Over 300,000 patients have been hospitalized out of 30 million Americans or so who have been infected with the flu. So what, if you take out your calculator, what percentage is that of hospitalization? You take 300,000 or so, right, 300 something, and you divide it over 30 million Americans who were infected. What percentage is that? 1%, right? So 1%, 1 out of 100 patients with the flu have been hospitalized. Does that make sense? 1 out of 100 patients who have caught the flu have been hospitalized. So it's a 1% hospitalization ratio is what we're seeing. What about the death rate from the flu? Does anyone know?
20,000 this year so far.
About this year alone, around 20,000 folks have died from the regular flu, right? 20,000 Americans have died from the regular flu.
Starting at January 1.
The flu season. So the flu season doesn't start January 1, right? It starts in the winter, right? So this year alone, guys, over 20,000 Americans have died, and less than 50% of us even care to get a flu shot. What is wrong with that? Right? What is wrong with that? Now, what is the death rate from the flu? The death rate from the flu is this. If you have 1,000 patients with the flu, on average, 1 death in 1,000. Does that make sense? The death rate from the flu, if you have around 1,000 patients, and this is gross estimates, right? From the flu, 1 death, 1 out of 1,000, right? 1 too many, but 1 out of 1,000 is like, whoo, at least it's not 100 out of 1,000, right? So that part I'm okay with. But I'm always surprised that less than 50% of Americans bother to get the flu shot when we have over 300,000 hospital admissions for the flu itself, the regular flu that our immune system recognizes already, right? Let's move over, though, to coronavirus. Before I tell you statistics about coronavirus, let's talk about how this stuff is spread. How is it spread, guys? Right? I heard droplets, right? I heard airborne, I heard contact. Yeah, mainly droplets, like the flu. Mainly droplets, like the flu. So whatever you do to protect yourself from the flu, you do to protect yourself from coronavirus because they're both spread by droplets. Make sense? Sneezing, coughing, talking, right? Whatever you do to protect yourself from the flu, you do the same to protect yourself from coronavirus. They're both respiratory. Now, there's a difference, though, in the incubation period. What is the definition of an incubation period?
The time to get exposed to virus and the time it shows symptoms.
Time of exposure to a time when you actually get that fever, right? Or that cough. The flu, that incubation period is not long, is it? You may be exposed to somebody with the flu, and a day, 2 days later at most, you've got a fever. Does that make sense? It hits you hard, and it hits you fast. You got this high fever, you're aching, you're feeling weak and tired, right? You're feeling like death is at your door. That's the flu. Hits hard, hits fast. Short incubation period, not long, a day, 2 days max, right? The flu. What is the incubation period for coronavirus? Yeah, 2 to 14 days. And we have reports of longer than 14 days as well, right? But on average, right? On average, 2 to 14 days. Most patients will develop symptoms, this fever, right, that comes on, this cough. Most patients will develop symptoms usually at around the end of the first week of incubation to like maybe the start of the second week, right? If 14 days is too weak, you can go for like 6 days with no symptoms, or you can go for as long as 2 weeks with no symptoms, right? This incubation period is very long, guys, and during this incubation period, that patient is contagious, unlike the flu. For the flu to be contagious, you need your fever, right? You need your cough. You need all these symptoms that go along with the flu for it to be contagious. That is not required for coronavirus to be contagious. So that part scares me, right? But if you look at the fact that it takes up to 14 days of just walking around silently, right, with this, it makes sense that you know the best thing we need to do at home or in our environment to minimize our risk to be even exposed to folks who are in the incubation period, right? So when I mention symptoms, when I give you data, what we should do is we should talk about immediately the things we can do to minimize those data, right? To minimize those data, to minimize our risk for getting and catching this. So between the flu and coronavirus, what do you think spreads faster as far as contagiousness? Coronavirus, because of the incubation period, Makes sense? I mean, when you get the flu, you get your fever, boom, you're at home. You're self-isolating. You're not going to work, right? But if you get corona, you may not have symptoms for days. And so you're out. You're shopping, right? You're hanging out. You're going to meet friends. This is why coronavirus is spreading at a faster rate than the flu. Does that make sense so far? Right? So, we talked about symptoms. We talked about incubation period. We talked about how this is spread through droplets, right? Does anyone know how long the droplets live outside of the body? Right? The latest news or estimate that we saw, I think that came out this morning, is that it can survive out of your body for a number of days. For a number of days. So that's not a good thing. Just outside the body. And it varies depending on the surface that it's on. If it's on metal, copper, and so there are different numbers depending on surface, right, of how long it survives. But it can survive for a number of days outside the body. With this knowledge that there's a period of incubation, with this knowledge that there is a period of time that the virus can live outside the body, what actions can we take today with this knowledge? How long do you wash your hands for?
24 seconds.
Around 20 seconds, right? With soap and water. With soap and water. Warm water, right? Multiple times a day. Yes.
Sing to yourself the birthday song twice.
Sing the birthday song twice. What if you're a fast singer? Or a slow singer? 3 times if you're a fast singer, right? So, 20 seconds or sing the birthday song twice, right? And if you're a fast singer, 3 times. That's for Facebook, right? 3 times. But wash your hands as soon as you get home from being outdoors, right? What other circumstances do you want to wash your hands? Before you eat. Meals. Coughing or sneezing. Should you cough or sneeze in your hand? Absolutely not. How do you cough and sneeze? Right? Maybe we should all like group practice, right? And so, wash your hands if you're at a restaurant. How many of you guys go eat out? Right? If you're at a restaurant, the first thing you should think about when you're at a restaurant is, how do you open up that restaurant door when the handle's there, right? Bring some napkins. Bring some napkins with you, paper towels, right? How many of you guys have pumped gas this past week? What have you done with the gas handle that you've touched? Right? These are all public places that we touch every day that it doesn't trigger, right? It's never triggered until coronavirus is here, right? Doors of public restrooms, how are they open, right? Maybe you should open the door with your hip. Maybe you should open it with your elbow, right? Bring some napkins with you. Yes? Perfect question. If you don't have access to soap and water to wash your hands, step 2 is hand sanitizer. Right? Hand sanitizer. Where can you buy it these days? Right? Step number 2 is hand sanitizer. And that hand sanitizer needs at least what % alcohol in it to be effective? Right? I heard like different numbers, right? It needs at least 60% or higher, right? Hand sanitizers need at least 60% or higher. Do you know why that's important? It's important because I've gone out and looked at stores and I've seen hand sanitizers that were 50%, right? I've seen products that were 50%. And so it's really important that if you find the hand sanitizers, you look at the label because it needs to be at least 60% to be effective. Make sense so far? Right? So hand washing, huge, huge deal. Because we touch public places all the time that we don't think twice about, like pumping gas. Right? What about grocery shopping, pushing the cart? Right? Things to think twice now with this. Yes?
A couple of doctors have mentioned when you wash your hands, be really careful under your fingernails. And they said that that's where
Yeah, good point. The point was to make sure that you wash under your fingernails because stuff gets caught under there, right? When you're washing your hands, if you got like long nails or whatever, make sure that your fingernails are covered. Kind of like what Mom used to tell me behind my ears, right? But now it's like below your fingernails. By the way, how does coronavirus get into us? Nose, mouth, eyes, right? Nose, mouth, eyes. How about ears? Well, it needs a portal to get into your lungs, right? The scary thing with the coronavirus is pneumonia. High rates of pneumonia that's being diagnosed with that. If you haven't gotten a pneumonia shot, make sure you get the pneumonia shot. If you haven't gotten your flu shot, by all means, get that flu shot, right? Less than 50% of Americans get flu shot. So it gets into us, eyes, nose, mouth. Does that make sense? With that knowledge, what do we need to do? Cover it up? Like hazmat suit, right? Our next meeting is going to be like all hazmat, right? Do you know how many times Americans or people in general touch their face a day? It's actually been studied. Per day, right? We touch our face over 50 times a day, subconsciously without being aware. I'm sure standing up here, I've already touched my face a few times, right? It's like, this, right? Messing with my hair. We do that without thinking twice because it's subconscious. But that can't be anymore, right? That can't be anymore. We now have to be conscientious about it. So quiet, right? So eyes, nose, mouth. All that means is when you're sneezing, in here, how far does a sneeze travel? 6 feet. Yeah, around 6 feet. You guys are good. Yeah.
Given that 6-foot radius, what are your thoughts about recommendations for everybody to sit 6 feet apart?
The recommendation that everyone should sit 6 feet apart. Yeah. So there are some new recommendations just out. California state recommendation that just got published either last night or this morning that I saw. And I want to ingrain into you a word that you should remember when it comes to this disease, right? This infection. The word is social distancing. Have you heard that word before? Yes. Social distancing, right? And it's not a word that I've heard in even once or twice a year. But that word should be a word that you should hear and ingrain every day. Social distancing. What does that mean, social distancing? What does it mean, guys? Distant between you and your social person. Huh?
Avoid mass gatherings.
Avoid mass gatherings. Where do we gather that are mass gathering other than today's lecture, which is going to be your last mass gathering, right? Sports event. What didn't the NBA just do something? They suspended? Wait, so are they playing games with no audience, or are they stopping games in general? They're shutting down all the games. Or games with no audience? I'm not sure.
Stopping the plane because the confines in the locker room are impossible to sanitize.
Yeah, I heard there was an NBA player that, two NBA players that were affected. So mass gatherings such as games, baseball games, football games, where else do we gather? Airplanes, elevators. Ooh, ouch. Colleges, where students sit together in class. Subways. Right? And I'm not here to create a panic. I'm here to say that social distancing is the best way to minimize yourself from somebody who is either sick or could be sitting around in that incubation period.
Should we avoid going to the gym then?
Should you avoid going to the gym? Ooh, good question. I've been to the gym twice this week, right? But if you can exercise at home, much better than touching every gym equipment in the gym that has been touched by every other hand before you. Does that make sense? You can wear gloves, or as soon as you're done with workout, go straight to the gym bathroom and wash your hands before you leave. And on your way out of the gym, do not touch the gym door handle on the way out of the entrance. Does that make sense?
It should be every day, even with the virus.
You should do it every day, but how many people do every day before coronavirus? Right? How many of us work out of the gym and go straight to wash our hands before coronavirus? We should, right? We should. It takes an epidemic to make us aware of what we should be doing anyway, right?
Even if you wear gloves, the virus will get on your gloves, right?
Yes, then you throw away the gloves. Disposable gloves. Expensive? Yeah. Yeah, well, disposable gloves, right? So I'm not against going to the gym, but you have to be 100% careful at the gym, because the treadmill, right, or the elliptical, you got to hold the bars, right? If you're doing TRX, you're holding something. If you're doing weights, you're touching stuff that everyone else has touched. So if you want to go to the gym, I go to the gym, right? But I'm super careful. I wash my hands as soon as I'm done, and I make sure that I don't touch anything that's public as soon as I'm leaving that place. Does that make sense? It's really important to exercise. If you're keeping yourself at home, social distancing, right, staying isolated, being at home is probably the safest thing, but being at home and not keeping physically fit will lower your immune system. Does that make sense? You got to stay fit no matter where you're at. Yes?
In the bathroom, it doesn't do any good to wash your hands and then grab the door on the way out, which is a dirty spot in the entire room. Use paper towel, whatever you have.
Good point. He says when you're in the bathroom, it doesn't do you any good if you wash your hands with soap and water and then you got to grab the handle on the way out, right? That's 100% true. So how do you address that? Paper towel. Paper towel, right? To grab the handle. Turning faucets on. Luckily, most of our equipment these days, you don't have to actually turn it on. There's like that little red light thing that turns on your water for you, right? So yes, you can exercise, but be very careful when you're out exercising in the gym. Okay? Social distancing is what we need to know with that. Yes? How about going to senior centers?
If you're sick, don't go.
If you are sick, do not go. If you are around somebody who's sick, make sure they have a mask on, right? If you're the person who's coughing and sneezing, you need a mask on. Does that make sense? Right, so Meals on Wheels is creating a process right now where you can go and pick up food and not hang around too long at the location, at the senior centers with that. So I have just canceled over 50 lectures in the next 3 months, right? And many of you guys have been to my talks, right? And so maybe this is like a public announcement. Dr. Trinh has canceled his lectures for March, April, and May. Right? At all the senior centers that I go to. Why? Social distancing. That's why. Because we don't know who could be incubating. Does that make sense? Ooh, good question. Then how do you get the how do you get the education if I'm not there, right? So this is what I'm going to do, guys. Once a week, I'm going to go on Facebook Live to give you guys education. Does that sound good? Yes. Right? So that you'll stay connected with me? Once a week, I would go on Facebook Live to give you education. And if you're wondering when and where, I guess you can just, I'll announce it somehow. I'll blast it to our patient email list that we have. If you're on my email list, we will send that to you. But once a week, I'll be on there. I'll give you a short update on coronavirus, and we can do health lectures online comfortably at home. Sounds good? Yeah, so I'll tell you how to sign up later on with that. Yes?
You said wear a face mask if you're infected or coughing or whatever. I've also read wear one if you do like what I do, which is stroke my
Touch your face.
mustache and my beard. I got my hand on my face all the time. They said it's good to wear a mask to keep your hand from touching your face.
Good point. He said that some people wear a face mask so that it can be a reminder for them to not touch their face. If you have access to a face mask and you need that as a reminder, by all means, right? As a reminder, yes.
Dr. Trinh, when you do your Facebook, if possible, if you can have it, let's say the same day and date, no, the day, I'm sorry, and the time, fixed, so we can coordinate our duties accordingly.
Yes, my Facebook live education will be at the same day, same time, every week, and I will send that information once I figure out the date and the time. Yes. Can you make it a podcast? Yes. Every Facebook lecture I do, I will put it into a YouTube video, and I'll send you a YouTube link where you can get updated. The benefit of Facebook Live is that you can go on there and ask questions through chat, right? Now, yes.
Dr. Trinh, I just want to go back to Meals on Wheels for a minute. I'm a volunteer driver in the car with my day. What can I do in case I don't think I have coronavirus, but if it passes long incubation period, what can I do to protect my clients? I'm going to be going to their homes and providing them with their meals.
If you are someone who sees patients or clients on a regular basis, do you have to physically be next to them as you deliver meals, or is that something you can drop off at the front door, or how does that work? You go in their house? Yeah.
I have to put two of them in the refrigerator, one in the refrigerator, one in the freezer, and some of my clients like me to open the hot meal for them.
Yes, yes.
So what can I do
if you are, yeah, if you feel healthy and you're not coughing and sneezing, I am not as worried about you wearing a face mask. I would be worried if you met a client who was sneezing and coughing, right? So I think maybe having a face mask on hand would be super important.
Should I wear kind of gloves or? I mean, I'm not worried about me. I'm more worried about me giving it to them. I mean, I'm fairly healthy. If I give it, I feel I'm going to be okay. But some of my clients aren't.
Yes, Jim?
So the three meals and oils providers in Orange County provide A12 and Orange County. You can expect that they will be issuing dietary protocols probably this week, if not first of next week. I've talked to those two executive directors earlier, and I know that they're working on it and sending us on our stuff. So certainly, can suggest that I think you can expect any of us who are facing senior support or all through the session. They'll have something for us.
Because my day is right to the last minute, the last minute,
And I'll follow up to make sure that that's true. That's the last thing.
So, what are the words that we should remember every day? Social distancing. Obviously, washing your hands, right? If you're sneezing, sneezing in your. These are the things we already know we do with the flu. But more important than ever is social distancing. Here is why. What is the death rate from coronavirus? Nobody really knows the true number, right? Nobody really knows. We know that the country that tested it the most is South Korea, and we know their numbers is like 0.6, right? That doesn't panic me, although it does panic me a little bit, but 0.6, it's under 1%. Anytime I think of something under 1%, right, I'm like, woo. But what is the death rate of coronavirus compared to the flu? Does anyone know?
2%?
I heard 10 times more.
Yes, coronavirus is 10 times more lethal than the flu. Right? 10 times more lethal than the flu. So if you have one patient out of 1,000 die of the flu, coronavirus is 10 times more lethal. So you're looking at maybe 100 patients, and that number is maybe 1 or hopefully less than 1. But 1 out of 100 is 10 times more than 1 out of 1,000. Do you see the difference? So although the symptoms are the same, the lethality of coronavirus is 10 times more than that of the flu. Does that make sense? Yeah. Why is it more lethal? It's more lethal because our immune system doesn't know it. Does that make sense? It's more lethal because our immune system doesn't know this virus. It knows the flu, and every year it sees the flu and attacks the flu, which is why the death rate is 1 out of 1,000. Our immune system does not know coronavirus-19, right? So when it doesn't know coronavirus-19, the virus does the damage before the immune system can figure it out. Does that make sense? What time do we have, guys? 10 o'clock, huh? Oh, I should wrap this up soon, right? Going on Asian time. Yep.
testing. In South Korea, they are testing 10,000 a day. What's going on here in the United States? What's the cost of testing? Are we testing people when they come to a hospital? Are there centers that are going to be planes if you happen to get tested? How long does it take once they test to know they're going to have the coronavirus? How's the process of the test?
The process of testing.
What is the question?
The question is the test kits, right? Who are we testing? How are we determining who to test? So we have specific guidelines in the emergency room of determining who's at risk to be tested. These test kits is available at the Orange County Public Health Department. And so our testing, we got a little bit of a slower start, obviously, than other countries. But I know we are ramping it up. We can now get results within 24 hours. Within 24 hours, right? We don't have to wait days for it. But because of the limitation of test kits, we are screening who to test, and obviously these are the sicker patients, which is why we're not getting accurate data, right? My last point for you today is this. So we know that at some point this will go away. Just like in Wuhan, the rate of new cases are going down, right? How do you minimize death? How do you minimize damage within that time span? Hopefully it's a few months. My hope is the summer comes and it goes away, right? That's our hope. We don't know if that's going to happen or not because we don't know this virus. What is the hospitalization rate for coronavirus? Does anyone know?
Whatever the time in the hospital is, they're gonna be at least 14 days.
What is the percentage of patients who need to be hospitalized or require higher level of care? If you have 100 patients with coronavirus, how many of them require some type of higher level care, including hospitalization? So if mild to moderate is 80%, that leaves 20% as severe or critical. Right? 20% as severe or critical that requires that visit to the hospital, that requires ICU, intubation, critical care. My concern is that number. I am not concerned with this death rate number because I don't know what the truth is about that. But the fact that on average, 1 out of 5 patients need to be hospitalized, and for the most part, the group that needs to be hospitalized are older folks. Folks in Laguna Woods, folks in Seal Beach, retirement centers. That is my huge concern. Let me ask you, even if you had a fraction of patients in Laguna Woods who have caught this, we have how many people in Laguna Woods, guys? 18,000. Right? Jim knew the exact number, right? So we have, like 17, 18,000 patients, 16,009, right? So let's say we had 18,000 patients in Laguna Woods, and everyone is doing their thing, right? Social isolation, right? Social distancing, and only 10% of Laguna Woods caught this. Only 10%, and 90% of Laguna Woods was spared from this virus. How many patients is 10% of Laguna Woods if there was 18,000 patients in Laguna Woods? 1,800, right? It's a numbers game. If 1,800 patients are affected in Laguna Woods with this virus, 80% of them can be handled at home, right? 80% mild to moderate. What is 20% of 1,800? Anyone know? 360 patients, potentially. Yes, that 20%, guys, is based on everyone who's affected. Young people, middle-aged people, old people. That's an average, right? But in that 20%, the bulk of it is the Laguna Woods age group, right? So what is 20% of 1,800? Is 360 patients would need hospitalizations. How many beds do we have at Saddleback Hospital that's available? How many beds do we have at Mission Hospital that is available, right? Maybe 8, less than 10. Do you see why I'm worried? This death rate thing, whatever it is, I'm not worried. I'm worried about our healthcare system not having the beds when we need it most. This is why social distancing is so important. If you can stay home, stay home. If you're going out to watch a movie, do Netflix, right? If you're thinking of a restaurant, maybe order in, delivery. See what I mean? I'm not here to say everyone should be huddled at home with 6 months of toilet paper. Right? Maybe 2 months, but not 6 months. Right? Because I'm not sure what toilet paper is going to do for coronavirus. Right? And by the way, the water in your tap, we've drank it for years and years and years. Why is it that there's no water at Costco? Is the water in your tap going to kill you? I'm not sure, right? Maybe. But anyway, guys, not here to panic you, but definitely be prepared. If you don't need to go out, do not go out. Church online. How many of you guys have churches that have videos online now? Podcasts, live Facebook videos, right? Church online. Very important. And I'm a churchgoer, right? God knows I need to go every day to confess for my sins. But the more people we have in a large group, think of spread. Think of incubators. I'm not talking about people who are sneezing and coughing. Think of incubators. This 14 days where you can walk around. Does that make sense? Yes. If you have an event, cancel it. If you have an event, cancel it and create that event, same event, online. Do a podcast, do a Facebook Live, right? Convert that event to an online event, especially for those who have tickets or whatever. Does that make sense? Yes.
You're talking about surfaces. What type of surfaces are you talking about? Flat surfaces or just like door handles?
What type of surfaces should we be concerned with? Surfaces that is touched by a lot of people.
In your home, like countertops, tables?
Yeah, mainly door handles, right? I mean, if you don't have a lot of guests in your home, in and out, you know, I wouldn't have to, you don't have to clean 5 times a day if you don't have a lot of guests at home. But in public areas, restaurants, movie theaters, church, right? Areas we go to every day where the public goes through, that needs to be wiped down on a regular basis. So make sure you have hand sanitizers, make sure you have access to soap and water and things of that sort.
What do you suggest rubbing down with? Is distilled vinegar?
What do you guys rub down stuff with? Something that has some alcohol in it. Clorox.
What about Clorox?
Clorox wipes.
What about white vinegar?
Lysol.
What vinegar?
Vinegar itself, you need alcohol to be. Oh, yes.
When should a person who has a head cold, the sinus head cold symptoms, maybe sore throat, be concerned about testing or talking with their PCP about it?
If you have a head cold or a sore throat or a sinus symptom, the question is it coronavirus? Should I be panicking? Or is it the simple cold, right? So my first thought is to contact your physician. Contact your physician and let them know what symptoms you have. And chances are, if your symptoms are mild, they're going to tell you to stay home, right? And not go out and get everyone else infected, whether it's the flu or whatever it is. But if your symptoms are severe, then definitely, you need to address that. Before you go to the ER, before you go to your doctor's office, if you have that fever and cough, call them first so that they will know and anticipate your coming. Does that make sense? Yes. You don't need to walk into an ER with your fever going around when everyone else is sitting around you, right? That's how it spreads. Call your doctor, call the ER, let them know your symptoms. They will give you some guidance. Because if they feel like, you're high risk, they may tell you not to walk into the ER in front of everybody else. There may be plan B to get you evaluated. Does that make sense?
Yes.
All right, guys, we got to wrap it up. Yes.
That's a good question in my head all this time is, in Asia, I grew up and born there, and we've always been told, somebody, there's a cold going around, or if I catch a cold, you wear masks. I mean, you see everybody. Now here, and then the reason is, well, if I had a cold, Mom seems like, especially when back home, it's the people who sneezes and coughs that don't wear the mask. So I'm gonna wear my mask just so even that few meters before I get home.
It's a question on wearing a mask.
And why wouldn't, it's my community.
Why wouldn't you wear a mask?
Protect yourself.
If you have a mask, by all means, if you want to wear it. Part of the problem is that there is a shortage of masks in the United States. We,
Daiso,
right?
$1 mask, but still, it would, instead of landing on my nose, it would protect me.
Sure. If you're out grocery shopping and you feel safer with a mask on, wear the mask. That's if you can find the mask. That's the more issue.
I ordered them online and they were shipped from China.
Really? China is shipping you masks. See, they're more prepared than we are.
They did say that there's no evidence that the shipped items could carry it.
All right. All right. Are we done yet, Jim? Is it about time? All right. I'll take like 2 more questions. Yes.
Probably as masks were on the ships in China, told to turn around and come back to China. I know they bought and paid for it, and they called the ships back and leaving here.
Okay. Yes.
I'm confused about the subject of pneumonia. A person takes the pneumonia vaccine. How does that protect, or does it not protect?
So the question is about pneumonia and coronavirus causing pneumonia. And what about the pneumonia vaccine? The pneumonia vaccine protects you against specific bacteria that causes pneumonia. But there are other things than these specific bacteria that can cause pneumonia, such as this virus. Thank you so much, guys, and we will close up.
Give you a chance to ask a question. I'm going to count Dr. Trinh is hanging out for a little bit. Thank you very much for coming. Drive safely on the way home. And stay.
Yeah, go home, stay home. The mask? Yeah. It depends on how strong the mask is. So,
They were asking about, make sure you tell them how to sign up.
okay. Do you guys want to sign up to be notified when I'm speaking? Okay, I want you to write down a website. Okay, I want you to write down a website. The website is going to take you to a spot where you can put in your email. And once I have your email, I'll email you guys. The website is coronaVupdate.com. Corona, V, like the letter V, update.com. So if you go there, it'll take you to a place to put in your email. You put in your email, and then when I am ready with my information, I will do an email blast to everybody. And V is in Victor. Yeah. Corona, V is in Victor, update.com. Yeah, yes, and virus. Thank you so much. Of course. Yeah.
Thank you.
God bless.